Hi, and thank you so much for popping by. My name is Dr. Rita Pobaluzwi, and you're most welcome to this conversation today. Despite Botswana's geopolitical status and classification as an upper middle income country, it has not been spared the public health crises typically associated with countries in the low income and developing nations or regions. Now, recently, Botswana declared that it was experiencing a public health crisis, and more specifically this week, news reports in the Sunday Standard Botswana were showing that there is a TB crisis due to some low quality TB medication that was being prescribed to patients. And these are medications that were acquired from India. As you might know, India is one of the largest manufacturers of generic TB and HIV drugs globally. In this news report, it is showing that the medication that the people are taking is having an adverse reaction to them. Only 40 people have reported these negative side effects. And as you can imagine, it likely means that there are more people who are experiencing these negative side effects but have not come through for various reasons. So essentially, the scale of the problem could be larger than what is currently reported. I speak about this story because, as I said, this is a reflection really of the crisis that Botswana is facing, the public health crisis that Botswana is facing. Botswana's middle income status is the reason why the country may not be a focus for global funders, because just by virtue of being middle income, it means that Botswana has the means to respond and to cater for this kind of situation happening, or this kind of public health scenario happening. Now, as I'm talking about this, I am thinking immediately of the corruption cases and corruption context that is associated with the central medical stores, or associated with the procurement process of acquiring these treatments and these drugs, right? So, and research has shown multiple times, I've been reading studies that are showing that one of the biggest hindering and negative effects on sub-Saharan Africa and Southern Africa is corruption when it comes to public health. And obviously, as usual, where there's a problem, there is an opportunity to fix it. So ideally, public health experts should be in partnership with the lawmakers or the decision makers, right? And as we know, Botswana is currently going through a parliamentary session, and as is expected, parliamentarians, are debating policies, regulations, laws, right? And ideally, we would expect that as they debate these laws and regulations and policies, they are being informed by data, by evidence based research, right? That is the ideal situation, because I just hope this is not one of those scenarios where public health experts are being ignored, or their advice and recommendations are being ignored for political gain, right? And I'm actually recalling a conversation that I had one time with a public health medical expert in Botswana, where the doctor was saying, he's actually a researcher and a doctor, and he was saying, it is time for countries such as Botswana to start producing their own HIV medications, their own tuberculosis medications, because when that happens, these medications are likely to be more effective because they have been tested on the people or the population that will actually be consuming them or taking them, right? So this takes money. This takes a lot of money. This takes a lot of time, as we know how long it took for HIV treatment to reach this stage. So it again calls for a lot of investment, a lot of prioritizing of the sector, because it is a high benefit to the community, even in terms of cost and even in terms of access, right? And I stated earlier on one of my YouTube posts on the wall, South Africa is creating or has created its own inhalable tuberculosis medication. Massive step. And there are multiple countries in the African region that are pushing towards creating their own HIV medications. And I hope these are medications that will benefit the whole of the African region because, as I said before, this is an expensive process and it is also quite a process to get approval to create the generic drugs based off the patents from the bigger companies. Something that is key to this topic when we talk about public health crises in the developing world and the developing nations, including Botswana, is the issue of corruption, poor health systems or overwhelmed health systems. And of course, when you have populations that are experiencing high margins of inequality, and the difference between the difference between the developed worlds and countries in sub-Saharan Africa is that when there's a public health crisis, the developed world is able to recover more quickly from a public health crisis compared to the long-term effects of a public health crisis in a country such as Botswana, right? And according to this story, they said 40 people have been identified to be having these adverse negative reactions to the Indian TB treatment. And as we know, 40 means there are likely many more others that have not come forth yet for multiple reasons. So the scale of the problem may be larger than what is reported currently. So yes, for me, I am quite concerned. It's a very worrying scenario at the moment. And as I've said, one thing about Botswana is that it has been lauded, it has been applauded, it has been celebrated for making major milestones, such as the success in the prevention of mother to child treatment programs, right? Where children are now being born HIV free, sorry. But at the same time, we cannot avoid or sugarcoat the fact that this public health crisis shows that somewhere there are major gaps. And perhaps we need to go back a little bit more to look at some of these lessons that we should have learned, that we have learned from the HIV crisis, and how we can recover as a community from such a public health crisis, right? Obviously, again, the public health slogan is Together We Can, leaving nobody behind. And this is the scenario where everybody needs to be involved. Alrighty, my friend, I thank you so much for popping by. I hope you're having a lovely day where you are, but most importantly, I hope you're having a healthy day wherever you're watching me from. Bye.